Anything that COVID has taught us is that we need to invest in our county infrastructure for health. We realized that Nairobi got overwhelmed, the rest of what used to be called provincial hospitals got overwhelmed, and ultimately, in fact, at some point we were locked into our own counties, into our own regions. And COVID is not the last pandemic that we're going to have. And so the investment in health infrastructure in the counties is of paramount importance. The final thing I want to say is just about the need to encourage screening. Cancer is a devastating disease. I think what was said about that, it attacks not only the body, lakini inamaliza hata uchumi wa jamii kabisa, inamaliza kabisa. But remember that if it's screened early, it means that it is going to be cheaper to manage. And so if we can encourage the people to come out for screening so that we start early interventions, I think that's the best thing we can do. In fact, if you have been here, kama kuna gospel utapeleka nyumbani, if you have hit the age of 40, for men, tafadhali, because men, we don't like to show weakness, but unfortunately, the disease will bring you to hospital eventually. So tafadhali, go for screening. Encourage our people to go for screening. It will save you not just in pain, but will save you in terms of money. So that's really the message that we can ask you to give.
As we know, the cancer burden in Kenya is high. Over 42,000 new cases every year, over 27,000 deaths. And many of these deaths are preventable. And so for us as the national government, we really want to emphasize on cancer prevention through screening. And our mandate as national government, when it comes to issues of health, we are in a devolved system, as we know, and health is devolved. But for us, our mandate is to build capacity of health workers. The second is to offer technical support to the counties. And the third one is issues around policies for the diseases. So for us as the National Cancer Control Program, we do a lot of policy work around cancer prevention and control.
The inauguration of this center is a major milestone towards bringing the much needed quality cancer screening and treatment services to Kirinyaga and Mount Kenya region. With this cancer center, many more people in our county will now access the care they need under one roof, with their families close by. It will save them traveling long distances and incurring costs in search of cancer treatment at national referral facilities such as Kenyatta National Referral Hospital, Kenyatta University Teaching and Referral Hospital, and all the other private hospitals. And there is no doubt that the socioeconomic impact of cancer, which includes loss of productivity, cost of care, and sometimes premature death, continues to threaten the achievement of our development goals and aspirations. In 2020, estimates from the Global Cancer Observatory indicated that there were over 27,000 cancer deaths in Kenya, with approximately 42,000 new cancer diagnoses in the same year. Here in Kirinyaga, 1 in 10 deaths is unfortunately due to cancer. Yet, we have learned that many cancers can be prevented. And even when prevention is not possible, early diagnosis can save lives. I urge all the residents of Kirinyaga County to embrace routine screening, since many forms of cancer diagnosed at an early stage can be managed and treated successfully. Indeed, evidence shows that 40% of all cancer deaths can be prevented if diagnosed early. The cancer screening services to be offered in this center will therefore supplement the Kerugoya Hospital mammogram machine for breast cancer screening and CT scan machine for early diagnosis of many types of cancer. Besides the usual clinical equipment, we have chirotherapy machine which will be used to treat cancerous cervical cancer lesions, as you have heard. The health sector plays an integral role in the socio-economic development of our county, and therefore we have invested heavily in infrastructure and service delivery reforms in many of our health facilities to ensure they have the capacity to provide affordable and quality health care.